When the second wave of the COVID pandemic hit India in March, nobody could have predicted the scale or the toll it would take on its population. Here at Snehaliya's Rehabilitation Centre, you would normally see the kids out playing, but like the rest of the country, we have gone into lockdown.
To India now, where the number of recorded COVID-19 infections has surpassed 24 million. 4,000 or more deaths were reported for the third consecutive day. Everywhere there are shortages of oxygen and medical supplies. Hospitals and medical staff, as well as crematoriums and mortuaries, are all overwhelmed.
The second wave of COVID is devastating India. Ahmednagar district, where Snehaliya operates, is one of the worst hit, with no beds, oxygen or medicines available to our largely rural population of nearly 5 million. Since March, a flood of positive cases has rendered the current medical facilities throughout the district overburdened and insufficient. There have been a steep rise in the number of corona-positive patients in the district, and at the start of April, the Times of India reported it was the top 10 worst affected districts in India, with over 1,000 new cases a day. The Hindustan Times further reported that from April the 15th to the 21st, when Maharashtra recorded its highest 7-day average in both cases as well as fatalities, Ahmednagar recorded the highest at 1.4%.
This also has protests coming in from parts of Maharashtra as oxygen has run out outside the collector's office. So those protests there by relatives as well as people demand answers.
हम लोग यहाँ बैठे हैं क्योंकि हम लोग चाहते हैं कि पेशेंट्स को कहीं से भी जिला प्रशासन ऑक्सीजन की आपूर्ति करे और पेशेंट को ऑक्सीजन कंटिन्यू मिलता रहे, क्योंकि वो पेशेंट की जान बचे। और दूसरी हमारी मांग है रेमडेसिविर जिन ज्यादा जरूरतमंद पेशेंट्स हैं उनको तुरंत मिलना चाहिए।
In response to the critical situation, we are taking a more direct approach, adapting, expanding and initiating new projects to provide vital support to as many of the 150,000 plus people who have tested positive with COVID in our district. Outreach work includes our ambulance service, which is COVID testing not only our rural communities but also nearby industrial workers. Our community radio, Radio Nagar, is helping to reach out to people in all corners of our district. We have also given our hospital over to COVID patients from the poorest sectors of our community, with around 70 patients a day receiving treatment. We have also opened a 130-bed COVID care centre. We are finally getting the life-saving equipment that we need, but still have a severe shortage of medical staff. The centre provides 8 days of residential, medical and quarantine facilities for asymptomatic patients and those with mild to moderate symptoms. All this is free of charge. At our rehabilitation centre, our amazing caregiver team are working 24/7 in providing the kids with educational as well as recreational activities. Everyone is quarantined to their own dormitories, but we are still able to provide 3 nutritional meals a day to our staff and beneficiaries, and they can eat as much as they want. Nobody goes hungry in Snehaliya. Our established 22 projects continue to operate our 24/7 helplines, offering support to all women and children to counteract the issues created by the shadow pandemic, including the significant rise in domestic violence. Since the pandemic started, there has been a disturbing rise in the number of child marriages, Our Childline team was able to successfully stop 110. Sneha offers an immediate free service for infants orphaned by COVID and also unwanted babies, unmarried mothers, rape victims, or any other mother unable to safely access maternity care. Snehalia has always been in the business of saving lives and changing destinies. We couldn't do this without you. Our heartfelt thanks to you all.